So the more dry thing that I do have to talk about is the P4P and VBR measures for 2025. So as a reminder, the 2025 VBR year has actually already started. That started September 1st. There have been emails about that. I sent out a video about that. But the P4P year, the 2024 P4P year ends on Halloween, so next Thursday. The 2025 P4P year starts right away on November 1st. We do have approval from Blue Cross for the measures, so I'll go through what we're going to work on in 2025. Short preview is that it's not very different than what we did in 2024. I know we've thrown a lot of stuff at you with PEDS readiness, HIV, all the other stuff we're doing, so we're trying to keep the actual P4P scorecard relatively consistent year over year. So just as a quick reminder of how this all works, every year the coordinating center looks at our data, comes up with some ideas for a P4P scorecard. We meet with the executive committee. We had our first meeting on that in June in Grand Rapids at our meeting, worked through a couple of virtual meetings to come up with a proposed scorecard, submit that to Blue Cross, and Blue Cross gives us the thumbs up to go ahead with that. Another reminder of how the P4P actually works. If you're a year one site, you're graded 100% on participation. Year two sites, which there actually are none coming up in 2025, it goes to 70% participation and 30% performance. Then once you get to year three, which most of you are, I mean, actually it's listed who's who in there, it goes to 70% performance and 30% participation. And then that point forward, you're graded mostly on performance. So the year one index, which we do have a few for the first time in a couple of years, we actually have some year one sites now. So 100% participation. So, we'll send out the scorecards. I just got the email from Blue Cross that these were formally approved on Wednesday night. So I will send an email with all this information with the actual PDFs of the scorecards. Year one sites, 100% participation, getting your data, getting, coming to meetings, doing your intervention template, the kind of same stuff that we've had, though I guess if you're year one site, it's new to you. Year two, this again, there's nobody actually in year two this year, but as a preview for the year one sites next year, as you shift into this 30% performance, the first thing that we'll have you work on, so as you kind of think about where to start, generally we'll have you choose the admission measure. So either as pediatric asthma or chest pain, then you'll be rolled into the collaborative wide measures. So year two sites generally get one site specific thing to work on, and then they become part of the collaborative. We wait to year two to do that because we can actually see what your year one performance is and then, factor that into the target setting. Year three is where the large majority of you guys that are in here now will be. This is very similar to the 2024 P4P scorecard. The participation stuff is exactly the same. So that stuff in the blue is unchanged. We did make a slight tweak on the performance measures. So in 2024, these top two categories were 25 points each. So your site-specific discharge measures, either chest pain or asthma, and your site-specific head injury method or measure was 25 points. Naloxone distribution as a collaborative wide was 10 points last year. Will stay 10 points, but we bumped up the two collaborative wide measures for the chest X-ray and the PE diagnostic yield. Those were both 5 points in 2024, and those will both be 10 points in 2025. So, think about the overall distribution of where the points were. We had 50 points on site-specific last year in 2024 and 20 points on collaborative-wide, shifting a little bit more towards leaning into the collaborative-wide measures. So in 2025, there'll be 40 points on the site-specific measures and 30 points on the collaborative-wide measures. Exact same measures in the same categories that we had last year, just a little bit of a rearranging of the point values. And then this applies to any pediatric only sites, of which there's only one right now. But since the pediatric only sites don't basically have any PE or naloxone cases, we don't consider them as part of those collaborative wide measures. So their points just get more distributed over the other measures. Okay, so the kind of last part of this is just to talk about the targets. So for your discharge measures, you'll have to choose one or the other. Again, chest pain or pediatric asthma timed to steroids. These targets have gotten a little bit tougher. Chest pain is up to 95%. It was 94 in 2024. And then asthma is up to 60%. I think that was 58 in 2024. So slight incrementing of these targets. So all year three and above sites need to choose one of these two. The vast majority of you choose chest pain, but you are always welcome and encouraged to choose PEDS asthma if you want to. Then you'll need to choose your head injury measure. So that's either adult or peds, 69% or greater for adult, 15% or lower for pediatrics. And then the collaborative wide measures, just kind of looking at these again. So the naloxone distribution, the target is 43%. That's up a little bit from 41% in 2024. Chest X-ray utilization, we've done really well on that. So that one is down to 25%. It was at 31 last year. So made some good progress on that. And then PA diagnostic yield, bunch of still 8.5%. We're trying to hit that. And I think as Michelle's data showed, we're probably not going to quite hit that in 2024. There's a little bit of data still to come in, but it's not looking great. So we'll keep the target the same for PE for 2025, and hopefully we can get that up to hit that 8.5%. Okay, so what do you have to do on P4P? Year 3 sites, choose your measure, chest pain or peds or asthma. Choose your head injury measure, peds or adults, and then complete your 2025 intervention template. So Katie emailed those out. We're going to give you guys a little bit of time when I'm done here to actually work on those in person, but on the actual intervention template is where you indicate your choice of which measures you want to work on. So those are submitted via Zendesk. Ideally, you probably email them to us. It'd be better if you did it through Zendesk. But try to get those in. The due date for that is by the 15th of November. So you got a little less than a month to get those done. Okay. Questions on P4P? Okay. VBR. So this is literally the same slides, the same information that I did at the Clinical Champions call a few weeks ago, and I put out a YouTube, or I guess that's a little video about that. So we offer 3 different types of VBR, same as every year: a 3% collaborative wide VBR, a 2% individual physician or hospital VBR, and then a 2% smoking VBR. So the 3% collaborative wide VBR, if you're in year 3 or above, you're part of that. There's no opt-in or opt-out of that. There is a little bit of extra work you have to do for the part 2 and part 3, the 2% ones. So I'll go through the details on that, but those are technically voluntary because you do have to do a little bit more than just be in medic. Okay, so a little bit of a change this year on the 3% collaborative wide VBR. We have always in the past, it's just been the 2 head injury measures, adult peds, and we had to make both of those all or nothing. If we met those, everyone that was eligible got the 3% VBR. If we didn't, nobody got it. What we changed this year is that we wanted to bring chest X-ray into it. We've had a lot of success on that. It's a collaborative wide measure, but it's not a site-specific measure anywhere. And we really wanted to make sure that we maintain the really nice success that we've had on chest X-ray. So we threw that into VBR. We didn't want to make it 3 for 3. That got a little challenging. So Blue Cross let us say if we make 2 out of these 3, that we will get the 3% VBR. So same targets as we've had before. Well, not before. Same targets for P4P. And then just basically, as a collaborative, we get 2 out of these 3. All eligible docs will get the 3% VBR. No action necessary on this one. You're in. Second one is this 2% hospital individual physician VBR. So this is the one that, same thing we've been doing for a couple, actually this year was the first year we didn't actually grade on individual physician level. So you do need to take some action on this one. So here's the steps for this. Each site needs to choose one of these 4 measures. So either the 2 head X-rays, head CT, chest X-ray, or PE diagnostic yield. Choose which one you want to work on for your site. The targets are there, same targets that are the collaborative wide targets. Let me know. Most of you have already done that. This came out in an email, I think in September or maybe in August. So I will follow up with those that I've not heard from. I think it's almost everyone I've heard from. So you need to pick your measure, and you need to actually meet the measure. So over the course of September of 24 through August of 25, actually meet the measure. And then for your individual physicians to get the increase, they need to have a Medic Tableau account and actually do the performance survey. So I want to take a quick second about the performance survey. I know that ends up being a little bit of a stressor for everybody as the deadline comes close. I want to highlight that we give you 6 months to do this. It comes out in March, and we've gotten I don't think it's never come from any of like the people in this room, but we tend to get when I say we, it's often Katie gets some kind of unkind, unpleasant interactions from people that are struggling with the technology. We had some trouble with it this year, but it mostly works, and it certainly works enough over the course of 6 months to get it in. So a little bit of a plea to kind of try to get on this, not with like 3 days to go in it, and when you've got 6 months to do it, and show a little grace towards us as we're trying to work through it. We would appreciate that. So, point four. So, if you guys remember, we made a change on this 2 years ago. Each individual doc was graded like if they met the target or not. We have problems with sample size on that. We'd have people who'd have 3 cases, and is that it just wasn't meaningful. So now we're grading on the hospital level. Kind of the other side of the coin on that is that if you as a hospital don't meet your target, you will have individual docs that do meet it that are not going to get they won't get the VBR because the site didn't reach it. I think most of the time you choose one that you're going to do well on, and you mostly make it, but that is a possibility that if you choose something that your site doesn't actually meet the target on, you will have individuals at your site who individually meet it but won't get the VBR. Positive to that, or I guess the better side of the coin, is that if your site meets it, even your docs who didn't individually meet it, as long as they do the participation portion, will get the credit for it. So I don't think there's a perfect solution to it, but that's kind of certainly, I think, just from like a math standpoint, having a bigger sample size to grade on is more accurate than the way we were doing it on the individual physician. So last VBR is the smoking VBR. I think probably about 30-40% of the sites in Medic are currently working on smoking VBR. Same inclusion criteria we've used in the past. So it's all patients with a diagnosis of COPD and who are listed as active smokers. So that's your denominator. And how many percentage of those patients that are offered or given smoking cessation counseling in their ED visit by a physician, and that is documented some way in the medical record. As a reminder, there's no abstraction to this, so there's no way for to gain credit by having your abstractor go through and find it. You've got to build an actual data transfer that captures whether or not you offer the smoking cessation counseling. So this is the same. None of this has changed, but just as a reminder how this has worked. What has changed is the target. So in the previous 2 years, to be successful, you had to have 1 month out of the year where you had 10% or more of these patients with counseling offered. That's gone up. So this year, you either have to have 1 month at 25% or 3 individual months at 10%. So from literally 0, which is where this started, we've made pretty nice progress. So I think pretty much every site that participated in this in 2024 did get enough counseling offered to meet the target. But as with everything that we do, as we succeed, the target gets harder, and we'll keep moving forward to get more people in. So there are, as we've done some of our site visits, I've heard some pretty cool ways that people have set up their EHR and their systems to do this. So if you are thinking about launching into it and want to get connected to someone who's been successful, we're always happy to do this. So just let me or Katie know, and we'll get you in touch with them. So what you do need to do, set up your EHR, so you're sending the right data to us, and then tell me whether actually, I should not skim over this, but the other point is that you have a choice in the COPD patients if you want to focus on patients who are only admitted, only your discharge patients, or all your COPD patients. So it's up to you. I think that it probably depends how you design your actual QI intervention based on your patient population. So just let us know about that. Okay, so next step for VBR, as always, make sure your physicians are enrolled in one of the Blue Cross PGIP POs. If you have a question about that, let me know. We're getting better and better at actually being able to figure out who these POs are and how to get you in touch with them. If you're doing the 2% VBR, choose your site level measure. Let me know as quickly as possible. Make sure your docs have a Tableau account. Make sure they do the survey. Again, ideally not in the last 2 days of it. And then if you want to do smoking, you got to set up your IT part, send your data, and then let me know your target population.